We start, though, with the COVID-19 situation here in South Korea. The daily caseload is expected to jump on this Wednesday, as we usually see an increase in the number of new cases in the middle of the week.
And also today, authorities plan to announce details on how Pfizer's COVID-19 oral treatment will be used in the country. For more on this and other updates, our Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
Let's start with a local situation. How many cases are we expecting today?
Well, we're expecting today's caseload to surpass the 4,000 mark today. From midnight to 9 p.m. on Tuesday, South Korea reported more than 3,700 cases. It's around 1,000 cases more than the day before, but as always, the increase is mainly due to the weekend effect. We're also seeing an increasing number of cases from overseas, and with fears over the inflow of Omicron variant, authorities are reviewing ways to strengthen antivirus measures for inbound travelers. And stronger measures may mean stronger inspections to filter out anyone who does not meet the travel requirements. Right now, travelers must take PCR tests prior to departing and prove that they have tested negative to board flights to Korea.
And Min-jung, Pfizer's oral treatments are due to arrive in South Korea very shortly indeed. We hear that there is going to be an announcement very soon about how and when they will be distributed.
Right. In the coming hours, authorities will be announcing the further details on how Pfizer's COVID-19 oral treatment, Paxlovid, will be used in the country. During the briefing, officials will announce the details on who will be receiving the pills, and they will also explain how the medicine can be prescribed and administered. The government has secured enough oral treatments for more than 1 million people, of which 760,000 will be Pfizer's and the rest MSD's. The first shipment, enough to cover 20,000 people, will arrive at Incheon Airport on Thursday at noon, and it's widely anticipated that the pills will be distributed for use as early as this Friday. Those first in line to receive the medicine are people being treated at home and at residential treatment centers. Among these patients, priority would most likely be given to seniors aged 65 and over and those with weak immune systems, and this is mainly because they are at higher risk of becoming severely ill. And just to recap, Pfizer's Paxlovid was given the green light for emergency use by the country's drug agency in late December, while molnupiravir developed by MSD is still under review.
Right, well, let's hope that this could become a game changer that could improve the current situation. But moving on to vaccinations. Min-jung, I hear that another vaccine could be granted approval today.
Right, Mok-yeon, we're still waiting to see whether the vaccine developed by U.S. drug maker Novavax will get approval for use in the country. The announcement will be made this afternoon after the Ministry of Food and Drug Safety finishes their review this morning. Novavax's vaccine has been developed using a more traditional method also used to develop influenza vaccines. So watchers say there are fewer concerns about side effects and storage is relatively easy. South Korea has secured 40 million doses of the vaccine, and once given the green light, authorities will use them to administer shots to unvaccinated people.
Okay, so some encouraging news in terms of treatments and vaccinations. We've also been seeing this recent downtrend in the number of new cases in South Korea. Does this suggest we might see a revision of the social distancing guidelines?
Right, authorities will be announcing new social distancing measures this Friday, and many are expecting the authorities to ease the current restrictions. But with the spread of the Omicron variant, it is difficult to expect an easing of restrictions equivalent to the first stage of the country's gradual return to normal scheme. Back in November, under the first stage, most venues could open 24 hours, and the social gathering cap was 10 in the capital region and 12 elsewhere. But since mid-December, restrictions meant many businesses had to close by 9 p.m., with social gatherings limited to a maximum of 4 people. So realistically speaking, watchers say it would be reasonable to find a middle ground somewhere in between, perhaps increasing the current social gathering cap to 6 to 8 people and extending business hours to midnight. But for now, we will have to wait until Friday for further details.
All right, Min-jung, as always, thank you so much for your report. Talk to you again soon.
Thank you.